did I say no way, absolutely not to weight loss surgery? It's a pretty easy answer. After careful consideration and tons of research, I realized it was not the right choice for my mental health or my body. My name is Amy, and I'm on a weight loss journey to lose 180 pounds. I started in January 2025 and have lost 20 pounds so far, with the assistance of dieting and Zepbound. I think it's important to preface this conversation with a little backstory about my weight. I was not overweight as a child or a teenager, and for most of my adult life, I weighed in about 180 pounds. But in my early 40s, I began struggling with both emotional and hormonal issues, and my weight started dramatically increasing. When I reached 300 pounds in early 2024, I was at the end of my rope and desperate for a solution. The sad thing was, I was at the risk of having to give up travel, which is my biggest passion in life. I was becoming more and more immobile, and personal care and daily life were becoming a chore. I was starting to have health issues that were clear warning signs. And I was also concerned that as I was aging, I was going to lose the ability to care for myself and my pets, and I didn't have any good options for health care. And honestly, this was not the road I wanted to go down. I've seen my relatives as they're aging and struggle with their weight and obesity related complications to the point that they're pretty homebound, and I didn't want that for myself. During 2023 and 2024, I did make multiple attempts at dieting using Weight Watchers app, but after a few months of little to no progress, I gave up. So I started looking into what would be the best solution for me to get my weight under control. I started researching weight loss surgery as I was not ready to even consider weight loss medication. I didn't have any exposure to anyone who was using it, and I didn't bother to look into the science behind it. And at this point, I didn't realize I'd suffered from severe food noise. Ultimately, there were three things that led me to reject any surgical intervention. One, the irreversibility of the gastric bypass or sleeve surgery meant the changes that would be made to my digestive system would be permanent. That was scary. And it seemed like such a drastic procedure when I believed I should have been able to lose the weight on my own. Two, the risk of weight regain was terrifying. I was not prepared to have this body altering surgery and not be successful. I didn't want it to be another thing in my life that I failed at. And there's also the aspect of the guilt of failing by having to use surgery to lose weight. It was a mental and emotional challenge that I wasn't willing to take on. And three, I knew I would struggle with the lifelong dietary changes necessary for the surgery to be successful. I felt it would have had an enormous psychological and emotional impact that I didn't have the tools to deal with. I felt the dietary restrictions would cause me extreme emotional distress. There were so many stories of people really struggling to intake food and having to intake minuscule portions and no longer enjoying the aspect of eating. And since my brain was wired to constantly think about buying food, think about eating food, and always worrying about any lack of food, I knew that I would find a way to eat around the surgery, and that would lead to the failure that I so desperately feared. I knew that if I had the surgery, there would be a huge chance that I'd have an emotional breakdown because I would be mentally suffering from the food restriction. The surgery would not eliminate the issue of the food noise in my head, which I now know can only be done with medication. And I didn't even know that that was my issue. I thought it was childhood related to the lack of food or food restriction. When I originally researched the surgeries and made my decision, I didn't know I had a medical problem, and I didn't know that there was a solution. I just thought I had no willpower and was terrible at controlling my diet. But now that I've done more research, I'm seeing more and more people who have had the surgery now using the GLP-1 medications to continue to keep the weight off or finish their weight loss journey. Because just like what would happen with me, the surgery did not solve their real problem. Yes, it has restricted their food intake, but if you don't solve the food noise issue, you are never going to get anywhere with weight loss. I did also worry about surgical complications, and I was really concerned about getting an infection, having bleeding or developing blood clots, or at worst, having leaks from the surgical site. And I knew the surgery leads to malabsorption of essential vitamins and minerals, causing malnutrition. Through the grapevine, I'd heard stories of the effects of this malnutrition, including excessive hair loss, extreme dental decay, and overall poor health from patients years after the surgery. And that was too big of a risk for me. At the end of the day, I'm truly glad I didn't elect for surgery now that I know about trizepatide and have been using it for a while. While I haven't been incredibly successful at losing weight on the medication, the reduction of food noise in my brain has been game changing. It's put an end to the never ending cycle of mental torture while trying to diet. I'm really committed to my goal of losing weight, and now that I've found the right tool for me, I'm really excited for my journey. I know it's slow going right now, but I hope looking back in 6 months that I won't be able to believe how far I've come. I also think it's important for me to say that I'm not passing judgment on anyone that has chosen or will choose to receive life changing weight loss surgery. It is a wonderful tool that has allowed thousands of people to lose weight and regain their lives. My decision to forego surgery is mine and mine alone and was based around my lifestyle, my health, and my mental well being. And now for the standard disclaimer. In this video, I've discussed medical procedures, but I am not a medical professional and nothing in this video should be considered medical advice. Please consult with your healthcare provider before making decisions about your health and do not rely on this video to make those decisions. And if you've made it this far in the video, I truly want to thank you for watching. Without you, I couldn't continue to make the content. And I do have a lot of weight loss left to go, and I'm excited to share that journey with you. So make sure you turn off your notifications if you want to be notified when future videos are released. I do put out a weight loss update video about once a month, so keep a lookout for that. Thanks again for watching. Have a fabulous day, and I'll see you in the next video.